All right, welcome back. Last time we finished our discussion of the circulatory system. This time, as you can see, we're going to move on to the lymphatic system. If I were a betting man, and I am not, but let's say that I were, I would bet that you probably have never heard of the lymphatic system. It's one of those systems where we talk about it if we get time, and it's intimately related to the circulatory system or the cardiovascular system, as you'll see. So remember when we talked about the cardiovascular system, we talked about arteries and veins, that arteries carry oxygenated blood, they drop off that oxygen at the tissues, and then veins take that freshly deoxygenated blood or oxygen poor blood, and then they return that blood back to the heart. Also, hopefully you'll remember that the arterial side is a high pressure side because of the function of the heart. So the left ventricle contracts really strongly, forces blood out into the aorta, which then expands and then recoils, and then that propels blood the rest of the way through the arterial system. Then on the venous side, we're going to have a low pressure system. So getting blood back to the heart takes a little more time, takes a combination of pumps from the respiratory pump to the muscle pump or the primary two. So, but in that whole description, basically the way that I laid it out and the way that anatomy textbooks lay it out is, so you've got blood coming down the arterial side. That blood flow slows down in the capillaries because the capillaries are really narrow vessels. They may only have just the endothelium itself and then no supporting tissue, no surrounding tissue to speak of. And so because of the narrowness of that blood vessel, that really causes the blood flow to slow down. Basically, the red blood cells have to line up one behind another. So it's kind of like, when you're on the highway and there's an accident and you move from 4 lanes to 1 and everybody slows down. Very similar thing as red blood cells move through the capillary beds. So their flow slows down, which is good, makes it easier for them to drop off oxygen and then for carbon dioxide to move into the plasma. And then those red blood cells, again, freshly deoxygenated, move into the venous capillaries, which then return into progressively larger veins, and then, again, back to the heart eventually. But because the arterial system is a high-pressure system, a lot of that blood plasma, which is the fluid that the red blood cells float in, a lot of that plasma is actually lost to the tissues. So that blood plasma, because of that high pressure, actually migrates across the endothelium of that capillary and moves into that extracellular fluid, which is more accurately called, well, extracellular is accurate, but more commonly called the interstitial fluid. So remember, the interstitial fluid is fluid between cells, and that serves as, this textbook described it as a nutritious soup, which is a fun way to describe it, but in that interstitial fluid, you've got oxygen, you've got amino acids, the building blocks of proteins, you've got glucose, and a number of other things that cells need to live. So that fluid from the blood, that blood plasma, because of the high pressure of the arterial system, moves from the arterial system into that interstitial space, and we lose quite a bit of fluid from the plasma to the interstitial fluid throughout the course of a day. So we can lose as much as 3 liters of blood plasma to the tissues because of that high pressure system throughout the course of the day. And remember that you have approximately 5 liters of blood. So if you're losing 3 liters of fluid to the tissues, well, that's a problem. Because as we lose that much fluid to the tissues, then necessarily blood volume is going to drop and blood pressure's got to drop. So in order for the cardiovascular system to continue to function, we have to have some way of getting that fluid, getting that, what has now become the interstitial fluid, back into the cardiovascular system. And the way that we get that fluid back into the cardiovascular system is through the lymphatic system. So the lymphatic system serves a really important purpose. There are 3 purposes that it serves, and I guess I'll talk about those now. But the primary purpose of the lymphatic system then is to return fluid back to the circulatory system, back to the cardiovascular system. So a way to think about it is that it drains excess interstitial fluid and brings that back into the circulation. So that's one of the 3 functions, is returning fluid back to the circulatory system. Another function of the lymphatic system is to transport dietary lipids, and lipids are fats. So in the intestine you have special lymphatic vessels called lacteals, and those lacteals transport fat that we absorb from the small intestine into the lymphatic system and then eventually back into the circulation. So a second function of the lymphatic system is to transport dietary lipids, and again, lipids are fats. And then the last one is that the lymphatic system is going to carry out immune responses. It's a really important component of our immune system. It's one of the ways that we're able to attack viruses and bacteria that make it into the circulatory system, that make it inside of the body. So the lymphatic system is going to be really important in immune function. So you can see that most important, that primary job of the lymphatic system there, to return fluids that have leaked from the vascular system, the cardiovascular system, back into the blood. So in terms of the three components, so you've got lymphatic vessels. So things to know about lymphatic vessels, they are similar to veins. So they're similar to both veins and arteries, but most similar to veins in terms of their structure. But there are some important differences between the lymphatic vessels and the veins, as we'll talk about. So you've got the lymphatic vessels, and their job is going to be to collect lymphatic fluid. And then you have the lymphatic fluid itself, which is known as lymph. So when we talk about lymph, that is the fluid inside of the lymphatic vessels. So when that interstitial fluid, the fluid between the cells, moves inside of a lymphatic vessel, it becomes lymph, or spelled out, or the longer version of the term, it becomes lymphatic fluid. And then we have lymph nodes. So lymph nodes are kind of the filters for the lymphatic system. So inside of lymph nodes, you have immune cells. So you have the lymphocytes, T cells and B cells, and then you also have macrophages. And so the job of those cells will be to attack invading pathogens. So viruses and bacteria, they will get attacked inside of the lymph nodes. And so we will filter that lymph. It'll go through a series of different nodes on its way back into the central circulation, and then it'll become eventually filtered lymph. We'll have killed off all the viruses and bacteria, and then we'll dump that fluid back into the circulation. So those are your lymph nodes. I often describe them as pool filters because they kind of are. And then the last things on there, so you've got lymphoid organs. So those include some you've heard of and some you haven't. So your spleen is an important lymphoid organ. So inside the spleen, we also have T cells and B cells and macrophages. So we've got immune responses that occur inside of the spleen. But in addition to that, inside the spleen, we also get rid of aging red blood cells. So remember, your red blood cells don't have a nucleus, so they can't repair themselves. And so because of that, they have a relatively short lifespan, somewhere between 3 and 4 months. And so as they age and become less elastic, we have to get rid of them. And so the spleen is the primary place that we do that. We also store platelets in the spleen, which hopefully you'll remember help in the clotting process. Other lymphoid organs, the thymus, which is in your neck, the tonsils, and you've got several different sets of tonsils. If you're like me, you probably think of the tonsils as the things at the back of your throat, which they are. Those are tonsils, but there are more than that. And then we also have the lymph nodes that we talked about. Trying to make sure I hit everything on my notes here. Yep. So one of the other things that this particular textbook talks about, and which I think is an important point, is that the lymphoid organs are the structural basis of the immune system. So again, that's one of those two primary functions of the lymphatic system. In addition to returning blood or returning fluid back into the cardiovascular system, the lymphoid organs and the lymphoid tissues are that structural basis of the immune system. It's where we attack those invading pathogens. All right. So I mentioned this. So a lot of the blood lost in the capillary bed, so that moves outside of the capillaries and becomes interstitial fluid, we got to return that to the central circulation to maintain blood volume. So as far as we talked about lymphatic vessels, and we talked about lymph. So as far as the lymphatic capillaries go, a few things here. So on this initial diagram, before I move past it, so you've got the arterial system with that oxygen-rich or oxygenated blood capillary bed, and then the venous system with that oxygen-poor or deoxygenated blood. And then amongst those vessels, that's where we have our lymphatic capillaries. So the lymphatic capillaries are among the other vessels in the capillary beds. So they actually are located in loose connective tissue, and they're kind of between the cells in that loose connective tissue. So for example, in the skin, the lymphatic capillaries are located in the subcutaneous tissue. So in that area where we have fat underneath the dermis, that's where you've got the lymphatic capillaries in the skin. All right, so then you can see there in that diagram the way they interact with each other. So, normally we just kind of work through arteries and veins, but now we've added the green vessels. Those are obviously the lymphatic capillaries or lymphatic vessels. And so if we look at them close up, one of the important things about the lymphatic capillaries is how permeable they are. They let a lot of things in, and not only do they let a lot of things in, they let a lot of really big molecules in, which is important for wound healing, one. So, if you get an ankle sprain and you get swelling around the ankle, when we drain that fluid, so a lot of that fluid is interstitial fluid, and so when the swelling goes away, it goes away because that fluid moves into the lymphatic system. But in addition to the fluid, we have to allow in really big cells like the macrophages. We have to allow in some of that cellular debris from the actual tissue damage that occurred when we injured our ankle. And so because of that, the lymphatic capillaries have really big openings, these mini valves. And when I say really big openings, I mean that opening is relatively large compared to the space that we get between the endothelial cells and the capillaries when we increase capillary permeability. So they are relatively larger than those spaces. And so because of that, again, allows larger molecules, things like bacteria and viruses to enter into the lymphatic system, which is what we want because that's where we're going to attack those invading pathogens. So the way or the structure of these lymphatic capillaries, so remember you've got inside of arteries and veins, you have that inner lining of those vessels, which is called the endothelium, which is a special type of epithelial tissue, that covering and lining tissue. So individual cells then are our endothelial cells, and so you've got one endothelial cell and another one here, but rather than what we see in the endothelium of the arteries and the veins, these endothelial cells are not joined by tight junctions. Rather, they actually have openings here. So because of those openings, those are those mini valves, they're basically flaps. And so when these flaps open up, they allow lots of fluid in, and again, lots of big molecules and bacteria, etc., to move inside of the lymphatic system. So one of the things about those valves that's important too is that they are forced open by an increase in interstitial fluid. So as the fluid accumulates around this lymphatic capillary, because of this anchoring, which here I'm referring to the anchoring collagen fibers, because these collagen fibers are anchored to the structures around them, as that interstitial fluid increases, it actually forces these mini valves open. And so because of that, that allows the fluid to move from being interstitial fluid out here inside of these lymphatic capillaries. And so again, once inside of a lymphatic vessel, that fluid becomes lymph. So increases in interstitial pressure force fluid inside of the lymphatic vessels. Conversely, if we get, or once a bunch of fluid collects here in the lymphatic vessel, as that fluid accumulates, it actually forces these mini valves shut. So the mini valves in every textbook I've seen are referred to as acting like a one-way swinging door. So they allow fluid in, but they don't allow it to move back out. So again, they're forced open by an increase in interstitial fluid, and then they're forced closed by an increase in lymphatic fluid. Make sure I hit on all the stuff there. Let's see. Yep, got all that. All right, and then lacteals I mentioned on the last slide. So the lacteals, again, are special lymphatic capillaries in the small intestine that are going to absorb and transport fats. And we'll talk more about them when we get to the digestive system. All right, so the basic structure of the lymphatic vessels, again, is pretty similar to the veins. In terms of, you've got these small capillaries that are going to initially collect lymphatic fluid. Then that fluid moves into larger collecting vessels. Once we get inside of the collecting vessels, those are much more similar to what we see on the venous side. So there are still the same three tunics like we saw in veins. So remember the tunics, the tunica media, intima, and externa. I did them out of order, but those are the tunics. I went middle first, sorry. So let me go in order. So you got the tunica intima inside, tunica media, and then the tunica externa. So you got the same three tunics, again, in these lymphatic vessels, or specifically in the collecting vessels that you have in the veins. But an important difference is that there are thinner walls on the lymphatic side, and there are more valves. So remember, on the venous side, in the extremities in particular, veins have valves to prevent backflow. Because they're a low pressure system, remember we talked about the muscle pump, as the muscles contract, they're going to squeeze on nearby veins. That pushes fluid up past the valve. When the muscle relaxes, gravity would tend to pull that fluid backward, but that valve in the vein is going to snap shut and prevent backflow of the fluid. Same concept in the lymphatic system, except that there are more sets of valves. Because again, the lymphatic system is also a low pressure system, and so it similarly to the venous system relies on things like the muscle pump to get fluid back up into, in this case, the thoracic cavity. So we move from capillaries to collecting vessels to trunks. So the trunks are going to drain fairly large areas of the body. They are paired, so there's one on the right side, one on the left side, and then they're named for the areas of the body that they drain, including places like the lumbar trunk, the bronchomediastinal, the subclavian, and the jugular trunk. Eventually, the lymph is going to flow back into two large ducts. There's the right lymphatic duct, which, as you can see on this drawing here, the right lymphatic duct drains the part of the body in green. So that's basically the right side of your head, your right arm, and then the right area of your chest. And then the thoracic duct, which is much larger, drains the lymph from everywhere else in the body. Both of them, and you can see the entrance there. So you got the entrance of the right lymphatic duct into the vein. So right there into that junction there between the internal jugular vein and the subclavian vein on the right side for that right lymphatic duct, and then the thoracic duct dumps into the same junction but on the left side. All right, so the transport of lymph. So once it gets inside of the lymphatic capillaries and the collecting vessels, how do we get it back up into those ducts? How do we get it back into that subclavian vein? So the way that we do that, and again, it's a low pressure system, so it relies on a lot of the same mechanisms that we see on the venous side. So the lymphatic system functions similar to the veins, where we've got a muscle pump. So again, as the muscle contracts, it's going to squeeze not only the veins, but also the nearby lymphatic vessels. And so when it does that, it'll compress them, push the lymph up, or proximally, if we're talking about the extremities. So it pushes the lymph up or proximally, and then when the muscles relax, again, the lymph would tend to be pulled back down by gravity, but those valves stop that. So the muscle pump is going to be really important to pushing lymph back toward the thoracic cavity. Other things, the pressure changes that we get, so the respiratory pumps. Remember we talked on the venous side, on the venous side about the respiratory pump, that as you breathe in and out, that changes pressure in the thoracic and abdominal cavities, and so those pressure changes function in a very similar way to the muscle pump, where they push blood, or sorry, in this case, push lymph back toward the subclavian vein. Arterial pulse. So your more superficial lymphatic vessels run along with veins, but as we get to the deeper lymphatic vessels, they actually run next to arteries. And then in the thoracic and abdominal cavities, a lot of the time they're actually bundled together in the same bundle of connective tissue. We've got a lymphatic vessel along with an artery and nerve. And so the arterial system then has a pulse, and so that pulsing of the arterial system produces some compression and relaxation in the lymphatic vessels, and so that acts similarly to the muscle pump to propel the lymph back toward the head. There is some smooth muscle in some of the lymphatic vessels. So in the larger ones, in your larger collecting vessels, they do have smooth muscle, and so then that smooth muscle actually rhythmically contracts, so it compresses and then relaxes or closes the diameter and then opens it back up in those lymphatic vessels, and then that squeezing or milking action pushes lymph back toward the neck. And then the last one there is any sort of movement. So whether that's active movement, like in the muscle pump, or even passive movement. So if somebody, rubs on your arm, or if you passively lift somebody's arm over their head, allowing gravity to pull on the fluids, both of those things are going to cause movement of the lymph. So from an injury standpoint, we see a lot of these things coming into play. So as mentioned, my standard injury example is a sprained ankle, because most people have had them who have been fairly active. And so if you sprain your ankle, you're probably aware, or if you've seen somebody else who's done it, you're probably aware that that thing tends to balloon up pretty quickly. So within 24 hours, they have a big lump on the lateral aspect or on the outside of their ankle. So that's swelling, that's edema. And so one of the things that we have to do as part of the healing process, or to speed up the healing process, one of the things that we want to do is to decrease that swelling. So initially, after the injury, we'll try to minimize how much swelling accumulates through a combination of ice and compression. So the idea there is if we ice after the injury, what that's going to do is to hopefully cause vasoconstriction, so to cause constriction of the smooth muscle around the arterioles. And so by doing that, hopefully that will reduce the amount of plasma that leaks out into that interstitial space. So hopefully that ice right after the injury will limit the swelling that accumulates. That's the idea behind doing that. Another thing that we'll do is apply a compression wrap, right? So just some sort of an elastic bandage. And so when you do that, that manual compression or mechanical compression is going to be exerting hydrostatic pressure, which is a pressure that pushes water out against that arterial flow. And so the idea there is that mechanical compression pushes back against the arterial compression or the arterial pressure that would push fluid from the capillaries into that interstitial fluid. So you've got that mechanical compression, and then other things we'll do, we'll elevate, right? So the standard after an injury is RICE or PRICE. You hear those pretty often. So RICE is rest, ice, compress, elevate. PRICE is protect, rest, ice, elevate. So I talked about ice and compression. Elevation, the idea there is if you prop their foot up over their head. So if you have them lying on their back and prop their foot up on some pillows, what you're hopefully going to do is to take advantage of that gravity to pull some of that fluid that tends to accumulate back into the lymphatic system. But in addition to that, one of the ways that we can reduce swelling is through the muscle pump. So one of the things we'll have an athlete do after an injury, or an individual do after they've injured their ankle, is to relatively soon after the injury, we'll have them try to do some range of motion stuff. Just try to get them moving the ankle, not putting any weight on it, but just with their ankle suspended, have them moving around. And if you've injured your ankle before, you've probably done some iteration of this. A really common version of range of motion for the ankle is to do ABCs, to spell out the ABCs with your foot. And the idea there is you're trying to generate that muscle pump. As you're moving the joint around, you're trying to push some fluid back into the lymphatic system to minimize swelling. Why do I want to minimize the swelling? Part of the answer to that is that hopefully by minimizing the swelling, you're going to minimize pain, because as that fluid accumulates around the joint, then it's going to press on free nerve endings, which are pain nerves, and so that tends to sensitize them and tends to make that injury more painful. So ideally, if we can get some of the swelling out, hopefully that's going to reduce their pain. So there's some interaction between those two. So by having them do some range of motion stuff, the goal is, or the idea is, to push some swelling out of the joint, which will hopefully then reduce the compression of the free nerve endings, which will hopefully then reduce their pain. Other things in terms of active and passive movement. So one of the other treatments that you'll see for an ankle sprain is if you go to the athletic training room, sometimes they'll do versions of massage on it. And so what they're trying to do, when you're doing massage on a swollen joint, you always start distally, so far from the injury, and work proximally. And so you start, in the case of an ankle, down by their foot, and you sort of apply some compression and you push up back toward their lower leg. And so the idea there is you're providing that mechanical pressure, trying to push fluid back into the lymphatic system. There's a special type of massage, which is actually this week's discussion board topic. And so that particular type of massage, what you end up doing is, rather than actually just like mashing on the joint, which you don't do if it's super painful, but you push on it a little bit in your normal massage. Rather than doing that, the idea is basically you kind of put your fingers on their skin a little bit and you pull on the skin and then you let it go. And then you put your fingers on the skin, pull on it, and let it go. And so the idea of doing that is that by that repeated traction of the skin and the underlying tissues by moving the skin, the idea is that you're going to be opening those mini valves and allowing fluid to move from the interstitial space back into the lymphatic system, and then hopefully that's going to be effective at alleviating the swelling. So that's the idea behind that particular type of massage. So a lot of things that we do from a rehab standpoint, especially like after an acute injury, right after it happens, are aimed at limiting the swelling and then reducing the swelling after it's accumulated. And so to reduce the swelling, we're going to take advantage of the lymphatic system and things like the muscle pump, and then active and passive movement to try to push fluid from the interstitial space into those lymphatic vessels. In terms of immune function, so the lymphoid cells, so I talked about T cells and B cells. So inside of your lymphatic tissue, so that includes inside of the lymph nodes, that includes inside of the spleen, inside of your diffuse lymphatic tissue, you've got these three types of cells. So you've got lymphocytes, which are one type, but there's two subtypes. So you've got T cells and B cells. And there's a separate chapter on the immune system, but the thing to know for now about those two is that B cells are going to be responsible for secreting antibodies into the blood. And what do antibodies do? Well, they mark invading pathogens for destruction. So things that invade the body are referred to as antigens. So right now, we all have to go get antigen testing once a week if you're a student, or once every other week if you're a faculty member. And so the antigen is the COVID-19 virus, or SARS-CoV-2 virus, right? And so that's the particular antigen. And so what that test, when they do the nasal swab, assesses is if you have that particular antigen, if you have the markers of that virus. And so antibodies, which are generated by B cells, attack that antigen, right? So that's the job of the B cells, is to generate antibodies to attack antigens. And again, antigens are invading pathogens. T cells are the ones that actually do the attacking. So basically the B cells, one of the ways to think about them is as marking the invading pathogens as bad. Like, okay, that's what you need to attack. They're kind of the directors of the action. And then the T cells are the ones that actually do the attacking. So they'll go through and actually attack the viruses. They do other things, but that's one of their big jobs. And then macrophages also do that. So macrophages particularly go after bacteria, but they can attack viruses as well. So, and they do that by actually enveloping the invading pathogen. They wrap around it, and then they kill it that way. They move it into their lysosomes, into their little stomachs, and then they kill it that way. So lymphoid tissue, so you've got basically diffuse, or I want to say collected is kind of a way of thinking about it. So diffuse or not tissue, that is lymphoid tissue. So diffuse tissue is what we see, for example, underneath the epithelial tissue. So like you'll see here in a minute, we'll talk about the mucous membranes. So inside of your mouth, down your throat, those are mucous membranes. So you've got a layer of epithelial cells with underlying connective tissue, loose connective tissue, that makes up the basement membrane. And amongst that loose connective tissue, some of that is lymphoid tissue, right? And so it's diffuse in that you've got that lymphoid tissue lining the underneath the epithelial cells throughout your oral cavity, throughout your pharynx, which is the back of your throat, and then down into the trachea. So that's your diffuse lymphoid tissue. And then it also lines the digestive tract as well, as we'll see here in a second. And then follicles are where you've got just, like I said, I guess collections is the way to describe it, of lots of lymphoid tissue in one relatively small place. Packages of lymphoid tissue, if you will. In terms of the lymphoid organs, so you see there's primary and secondary lymphoid organs. In the primary lymphoid organs, that's where the immune cells divide and mature. So the examples of primary lymphoid organs are your red marrow. So again, red marrow is where we make blood cells, both red blood cells, but also white blood cells. And then in the thymus is another primary lymphoid organ. That's where the T cells go to mature. So we make immature T cells in your red marrow, and then for the most part, they go to the thymus to mature. Then in our secondary lymphoid organs, that's where our immune responses occur. So that includes places like the spleen or the lymph nodes. That's where those T cells, B cells, and macrophages are actually going to come into contact with invading pathogens, antigens, and where they'll actually attack them. So those are our secondary lymphoid organs. So again, those include the lymph nodes, the spleen. So So this is something we'll talk about here in a second. Mucosa-associated lymphoid tissue, which is MALT tissue, but that includes the 4 tonsils, and then there's also little collections of MALT tissue in the small intestine and the appendix. So as mentioned, the lymph nodes sort of serve as a filter, like I said, a pool filter, for the lymph. So once we move lymph into the lymphatic capillaries, into the collecting vessels, along the way, that lymph is going to move through lymph nodes. And so again, the lymph nodes, their primary job is going to be to filter the lymph. And so what they're going to do is, and probably best explained in combination with the structure. So obviously this is a lymph node. You can see they're kind of bean-shaped. And in saying they're shaped like a bean, there's a convex surface that curves out, and then a concave surface that curves in. So the lymph only flows in one direction, so the incoming lymph comes in on the convex side. So it comes in on the side that curves out, and then exits on the side that curves in, so on the concave side. So the lymph flow then goes this way. So what you can also see from this diagram is that there are a bunch of vessels coming in. So we've got 5 of them there, and only a few vessels going out. So we've only got 2 of them there. Why that matters is if you've got a lot of lymph coming in and relatively little going out, that's going to really slow down the flow of lymph. And as we slow down the flow, that's important because that gives those immune cells, T cells, B cells, and macrophages, the opportunity to attack any pathogens that happen to be in that lymph. So there's 2 primary areas of the lymph nodes. There are more if you want to get into more detail, but the 2 primary areas, the outer area is called the cortex. And so that's something that you're going to see repeatedly in different anatomical structures. So for example, when we talk about the brain, you've got 2 cerebral hemispheres, left and a right, that make up most of the brain. The outer covering of those cerebral hemispheres, where most of the cell bodies are, that's called your cerebral cortex. So the outer part of the brain is the cerebral cortex. When we talk about the endocrine system, we'll talk about the adrenal glands. And so the adrenal glands sit on top of your kidney. The outer part of them, or kidneys, the outer part of them is the cortex. So the cortex is always the outer part, at least as far as all of the anatomical examples I'm aware of. So same thing here. So the cortex is this outer part of the lymph node, and the medulla is the inner part. There's a little bit different cell distribution between the 2. So in the cortex, you have primarily B cells that are going to, again, identify incoming pathogens so that they can produce the antibodies to mark them. And then in the inner part is where we've got primarily T cells, which again will do the attacking of any of those invading pathogens. Now there are also some T cells out here in the cortex, but for the most part, they're in here. One of the interesting things, kind of the cool things about the T cells, is that they circulate along with everything else. So your T cells will come in, they'll go through this lymph node, they'll get dumped back into the venous side, they'll then be part of the regular circulation, so they'll be just in the blood. And so then they get circulated, they go through the pulmonary circuit and then back into the systemic circuit of the heart that we talked about, or of the heart and body that we talked about. And then on the systemic side, the T cells can actually migrate from the capillaries into that interstitial fluid, and they can attack things out there, right? And then they eventually get moved back into the lymphatic system, and then they just circulate. So they're kind of like, circulating little police officers for your immune system, if you will. They're just constantly on the move. And so then they attack any pathogens that they see. So thought that was kind of cool that they're just on the move, looking for pathogens to attack all the time. So those are your lymph nodes. So you've got hundreds of them, somewhere in the neighborhood of 600 of them. So the lymph will pass through a series of them to get back into that subclavian vein. And so then that's when you've got your clean lymph. And so then we just dump that fluid and any proteins or fats or anything else that's left, lymphocytes, anything that's left back into the venous side, and then it enters again the systemic circulation after going through the pulmonary circuit. In terms of the spleen, so I kind of talked about what it does earlier. So it is the largest of lymphoid organs. It's in your abdominal cavity. It's in the upper left quadrant, or left upper quadrant of your abdominal cavity. So it's just underneath your diaphragm on the left side. Of the organs of the abdominal cavity, it's the most commonly injured. So if somebody gets abdominal trauma, so let's say they're a football player and somebody spears them in the stomach or something like that, of the organs of the abdominal cavity, the spleen is the most commonly injured. The liver is up there as well. And the reason those two are injured is because they're solid organs, as opposed to the stomach and intestines. Those are hollow. There's nothing in there other than what it is that you've eaten. So those are pretty compressible. The spleen and the liver, however, are not. And so the spleen tends to be fairly commonly injured. So in terms of it being the largest lymphoid organ, so you can see that our lymphocytes, our T cells, and our B cells make copies of themselves there. So again, that's what cell proliferation means. It means they make copies of themselves. So you've got active copying of the T cells and the B cells. Immune surveillance, we're looking out for any invading pathogens. I mentioned earlier that the spleen removes the red blood cells that are aged and then recycles their products. So we lose some of the iron from breaking down those red blood cells, but we actually recycle a lot of it, and the liver does a lot of that recycling. And then, as mentioned earlier, it also stores platelets. About a third of the platelets that you have at any one time are stored in the spleen, so it plays a really important role in the clotting process if we have lots of bleeding. And it also stores monocytes, which are another type of white blood cell. There's two types of pulp that you can see there, red pulp and white pulp. Red pulp is where we're going to clean out the red blood cells. White pulp is where the T cells and B cells are going to be active, so that's our immune response area. So in the red pulp, in addition to getting rid of the worn out red blood cells, we also take care of, or attempt to take care of, bloodborne pathogens there. So that would include things like hepatitis, syphilis, malaria, and HIV. And if you're familiar with any of those diseases, you know we are more or less good at taking care of some of those. So like malaria, not so good at it. HIV, syphilis, same thing. But some of the hepatitis subtypes we're pretty good at taking care of there in the red pulp there. All right, so I mentioned this one earlier, the Mucosa-Associated lymphoid tissues, or MALT tissues, which is redundant, but that's okay. So those are, your mucous membranes, again, are those covering and lining membranes inside of the oral cavity, inside of the respiratory cavity, respiratory tract, and then also inside of the gastrointestinal tract. And so again, just underneath those epithelial cells that line those tracts, you've got a basement membrane, and in that basement membrane, there we go, you've got some of these lymphoid tissues. And so you've got some of those same immune cells, the lymphocytes, and the macrophages that'll attack invading pathogens. So the tonsils, sorry, my dog has an itch. The tonsils, you can see there. So I mentioned earlier that if you're like me, you think of the tonsils in terms of that thing at the back of your neck, which they are. So that's actually the palatine tonsil. That's the one that you see at the back of your throat. And then the lingual tonsil. So remember, anything lingual deals with the tongue. So the lingual tonsil, you can see here, is underneath the tongue. The pharyngeal tonsil, so when we get to a later chapter, we'll talk about the pharynx. So there's three. The pharynx is basically the back of your mouth and nose. But there are three components to it. There's the nasopharynx up here, the oropharynx down here, and the laryngopharynx down here. And so up here at the nasopharynx, that's where you've got your pharyngeal tonsil. Those are more commonly known as the adenoids. So sometimes kids have those removed if they have repeated ear infections. Sometimes they'll get their adenoids taken out. And then where the tubes from the ears dump into the pharynx is another set of tonsils called the tubal tonsils. So what all the tonsils are then is just little aggregations, little collections of lymphoid tissue. And one of the cool things about them, and so you can see the structure of the tonsil here, if we look at it up close, so they have these crypts. And so basically what these crypts do is sort of invite in or allow in different bacteria and other pathogens. And so those invading pathogens are basically like, oh, I've got tissue to infect. Better get after it. And so the bacteria come down into these crypts, and then they migrate through that superficial layer of epithelial cells. And then once they get underneath that superficial layer of epithelial cells, that's when they find the little lymphoid follicles, which have your lymphocytes and, again, your macrophages. So these are immune tissues then inside of the mouth and throat in the case of the tonsils. In the case of, oops, I don't have a picture. Thought I had a picture. Peyer's patches, same concept, but in the small intestine. Because sometimes pathogens make it through, down the esophagus and through the stomach and into the small intestine. And so we'll attack them, any invading pathogens in those Peyer's patches. And then in the large intestine, we have our appendix. And so the appendix is an offshoot, it's in the lower right quadrant off of your large intestine. But in there, we have lots of bacteria, and we also have lots of good bacteria. So if you are familiar with the idea of, trying to think of the term, but basically all the stuff that's in yogurt, probiotics, there we go. If you're familiar with probiotics, those are good bacteria that serve useful functions for our digestive tract. So a lot of the yogurt ads and various other things for kombucha and various other ads talk about probiotics. So those are good bacteria, and we have a lot of those in the appendix, but in addition to that, we also have some bacteria that are pathogenic that we want to get rid of, and so we have some lymphoid tissues around the appendix as well. And then the last thing is the thymus. So as mentioned, the thymus is where we're going to get maturation of some of the T cells, and the thymus is in the neck area. And as you can see there, it atrophies, which means that it shrinks after puberty. So as we age, it eventually gets replaced by fibrous and fatty tissue. And so why that matters is, with all of this, with all the COVID stuff and all of the stuff about the pandemic, you see discussions about the higher mortality rate of the virus in older folks, right? And so part of that is because of the fact that our immune system is less good as we age. And so another component, or a component of that, is that decreasing function of things like the thymus across the lifespan. So again, if it starts to atrophy after puberty, we're going to produce less and less mature T cells as we age, and so we're less able to attack those invading pathogens later in the lifespan. Now it continues to produce some, it doesn't totally go away, but because of that reduced number, we're just less good at attacking invading pathogens. So things that wouldn't be serious illnesses for us when we're 20 can be serious illnesses for us when we're 70 because of that reduction in the capacity of the immune system. One of the other cool things about the thymus, so it has a barrier like the blood-brain barrier, so it doesn't allow invading pathogens in, and why that matters is that avoids exposing those pathogens, again, antigens, to those T cells before they're mature. That would cause early maturation of them, and so to prevent that, we have a special barrier in the thymus that doesn't allow those pathogens to cross it, so we can allow those T cells to mature and allow the ones that are already mature to take care of those particular antigens. And that's it. So that's it for the lymphatic system. So I forget what we're doing next. I didn't look at the syllabus. I'm just trying to get through today. So we'll see you for whatever the next module is.